Good morning. And next point, that is thyroid diseases. So before that, what is thyroid gland? What is function of, or what are the functions, or what is the role of thyroid gland? So what is thyroid gland? Yes, this is a gland which is a butterfly shaped endocrine gland. Yes, it is a butterfly shaped endocrine gland, and which is located. So what is location of this gland? Which is located in the lower front of the neck. Yes, which is located, this thyroid gland is located in the lower front of the neck. This thyroid, so what is role or what is important this gland or what is function? This thyroid gland is make thyroid hormones which is secreted into the blood and then carried to every tissue in the body. Yes, what is thyroid gland? This gland, it is a butterfly shaped endocrine gland. Where it is located? It is located in the lower front of the neck. And what is function or what is role? This thyroid is make a thyroid hormones and which is secreted into the blood and then carried to every tissue in the body. Then this thyroid hormones helps the body use energy, stay warm, and keep the brain, heart, muscles, and other organs working as well. Then see here, you can see here the thyroid gland. Here we can see the thyroid gland or where it is located. Next, yes, this thyroid gland is a highly vascularized organ which is located anteriorly in the neck and deep to the then deep to the platysma, then sternothyroid and sternohypoid muscles extending from fifth cervical to the first thoracic vertebrae. Then this gland is consist of two lobes, left and right, which is connected by a thin median isthmus overlaying the second to the fourth tracheal ring, typically from H or it is a U shape. Then the beneath the vascular layer of this pretracheal deep cervical fascia, then thyroid gland is which is surrounded by a true inner capsule and which is a thin and adheres closely to the gland, and the capsule sends a projection into the thyroid forming septi and dividing into the lobes and lobules. Then, so what is the action of this thyroid hormone? Yes, this thyroid hormones increases the basal metabolic rate and the rate of oxygen consumption, understand, or basal condition by stimulating the use of cellular oxygen in order to produce adenosine triphosphate. Then second, it also stimulates the synthesis of additional sodium potassium pump. Then next, it is helpful in the regulation of metabolism. Then the thyroid hormone stimulate the protein synthesis and also increase the glucose and also increase the use of glucose and fatty acid for adenosine triphosphate production, that is ATP production. Then next, this thyroid hormone also enhance some action of the catecholamine because they upregulate a beat receptors. I'm repeating here. Yes, the thyroid hormone which increases the basal metabolic rate, the rate of oxygen consumption, and understand a basal condition by stimulating the use of cellular oxygen in order to produce ATPs. Then it stimulates the synthesis of additional sodium potassium pump. Then in the regulation of metabolism, the thyroid hormone stimulate the protein synthesis and increase the use of glucose and also the fatty acid for the ATP production. Then that the thyroid hormone enhance the some action of the catecholamine because they regulate a beat receptors. Then there are two diseases, that is hyperthyroidism and second that is hypothyroidism. Its name itself indicate hyper it means more and hypo it is less. Then the hyperthyroidism and thyrotoxicosis are used interchangeably. However, each refers to slightly different conditions. This hyperthyroidism it means overactivity of the thyroid gland with resultant excessive secretion of thyroid hormone and accelerated metabolism in the periphery. Yes. Then this toxicosis refers to the clinical effects of an unbound thyroid hormone regardless of whether or not the thyroid is a primary source. There are different number of pathologic causes of hyperthyroidism in children as well as adult. In children as well as adult. Next, it includes grave disease, then toxic adenoma, then toxic multinodular, then goiter, then thyroiditis, then grave disease, and then this grave disease which account for approximately 95% cause of hyperthyroidism. In order to understand the pathophysiology of this hyperthyroidism, it is necessary to understand the normal physiology of your thyroid gland. Here you can see the normal thyroid gland, and here we can see also the hyperthyroidism. Yes, here we can see that this it is your normal thyroid, and here in second image that is hyperthyroidism, it means enlarged thyroid. Here we can see the epidemiology, it means how much it is spread out, how it is its percentage. Then next, so what is hyperthyroidism? Yes, this hyperthyroidism is due to increased level of thyroid hormone. Yes, it is due to the increased level of thyroid hormone. Then diffuse toxic goiter, that is grave disease. Then toxic multinodular goiter, that is pulmonary disease, and toxic edema. Then this hyperthyroidism is a hyperactivity of this thyroid gland with, yes, it is a hyperactivity of what? That is your thyroid gland with sustained increase in the synthesis and the release of hormones. Then we will see the causes, that is etiology. First, that is ectopic thyroid disease. Then second, first ectopic thyroid disease. Then second, grave disease. Then thyroid adenoma. Then multinodular disease. Then subacute thyroiditis. Then injection of thyroid hormone. Then pituitary disease. Injection of food containing thyroid hormone. Then high dietary iodine intake or very low dietary intake. Then genetic factors. These are the few causes of this thyroid hyperthyroidism. Then we see the pathophysiology for this. Yes, in that first, this hyperthyroidism, it is characterized by loss of, or it is characterized by loss normal regulatory control of your thyroid hormone secretion. Yes, I am repeating. See here, this hyperthyroidism which is characterized by loss in normal regulatory control of thyroid hormone secretion. Then due to this, the action of thyroid hormones on the body is stimulatory. This then it causes hyper metabolism result, then increased sympathetic nervous system activity, then due to this alteration secretion and the metabolism of hypothalamic pituitary and gonadal hormones. Then next, that is there is excessive amount of thyroid hormones stimulate the cardiac system and the increased adrenergic receptors. then it then that is tachycardia and increased cardiac output, then also increased stroke volume and peripheral blood flow. Then due to this the negative nitrogenous balance, there is then lipid depletion and the resultant state of nutritional deficiency, and then it causes or finally that is hyperthyroidism. Then next, that is clinical manifestation. That first symptom, these symptoms and their severity of this symptom which is depend upon first that is duration, and second that is extent of thyroid hormone excess and the age of individual. Here the symptoms and the severity of the symptoms depend upon duration and the extent of thyroid hormone excess and the age of the individual. Then first symptom, nervousness and irritability, then palpitation and tachycardia, then next heat intolerance and increased sweating, then tremor, then weight loss or weight gain, then increase in appetite, frequent bowel movement or diarrhea, then lower leg swelling, then sudden paralysis, next shortness of breathing with exertion, then decreased menstrual flow, then impaired fertility, next sleep disturbance including insomnia, then next changes in vision, photophobia or light sensitivity, eye irritation with excess tears, then diplopia or it is called as double vision, then fatigue, muscle weakness, thyroid enlargement, peripheral myxedema, it means fluid buildup, that is buildup of fluid in the tissue the shine above the shin bone may be seen in the grave disease. Then next symptoms, hair dry, here we can see. Next, that is investigation or the what is diagnosis for this. First, that is collection of history, then physical examination, next that is ophthalmic examination, ECG or arterial tachycardia, then thyroid functioning test, that is T3 and T4, then thyroid releasing hormone stimulation test, then radioactive iodine intake, that is RAIU, then thyroid scan. So these are the few diagnostic tests which are used for thyroid diseases, that is investigation. How to investigate? Next, that is treatment. First, that is radioactive iodine taken by mouth. This radioactive iodine is absorbed by your thyroid gland, where it causes the gland to shrink and symptoms to subside usually within 3 to 6 months. Next, that is using a radioactive liquid therapy to treat a thyroid cancer. In that first step, this iodine therapy specifically targets the thyroid and has very little effect on other parts of your body. In that first step, this radioactive iodine is ingested in a drink or capsules. Then second, these radioactive iodine molecules are absorbed through the walls of the digestive tract into the bloodstream. Then next, this thyroid gland needs iodine to work and absorb the most of the radioactive iodines. Then next, this radiation destroys cancerous and normal thyroid cells. Next, that is anti-thyroid medications. Use of anti-thyroid medications. These medications, so what is the role of this medication? These medications are used to reduce the symptoms of hyperthyroidism, and also preventing your thyroid gland from producing an excess amount of hormones. Example of this antithyroid medication: methimazole, that is tapazole. Then these symptoms usually begin to improve 6 to 12 weeks, but treatment with antithyroid medication typically continue at least 1 year, at least a year, and offer this longer. Then next, use of beta blockers. These drugs are commonly used to treat high blood pressure. They won't reduce your thyroid level, but they can reduce rapid heart rate and help to prevent palpitation. Then side effect may include fatigue, then it also include headache, upset stomach, then constipation, diarrhea or dizziness. Next, that is surgical treatment. In severe case, there is need of your surgery. This surgical treatment of thyroid disease, this is depend upon two factors. First is the type and extent of thyroid present, and second, that is anatomy of thyroid gland itself. The most commonly preferred procedure include lobectomy with isthemectomy. Then what about nursing management? Imbalanced nutrition, less than body requirement related to anorexia, and increased metabolic demand inappropriate. Then second, that is activity intolerance, which is related to exhaustion secondary to accelerated metabolic rate, resulting in a which results inability to perform activity without shortness of breathing and significant increase in heart rate. And that first, that is assist with regular physical activity, assist in activities of daily living, and assist the patient to schedule rest periods. And next, risk of injury, then hyperthermia, then impaired social interaction, which is related to extreme agitation, then hyperactivity and mood swing. So this is about hyperthyroidism.